So the talk is about what are we currently using and where are we going in the post-transplant setting. So still induction and transplant is standard. Consolidation is sort of more ambiguous, and maintenance is also a clear standard. But it's a question about what drugs and how to do it. So first, when it comes to consolidation, which is you sort of repeat the same regimens as induction after transplant, I don't think it matters whether you call them consolidation or you put them like in the German HT7 trial, where you put all cycles before and no consolidation. But it's important probably how many cycles you have to get the best possible response and the highest number of MRD negative patients. So there was a study until today actually trying to use a CAR-T ide-cel in this situation as a consolidation to improve benefit for the patients. That study was terminated today actually. That was a study for those not getting into CR, so the bad responders. But it was difficult to include because results are very good these days. So that study actually stopped today. But still, consolidation is a standard in almost all trials. The standard arm contains induction and consolidation, usually 4+2 cycles. It varies a little bit. And will probably be like that for the foreseeable future. So when it comes to maintenance, it's a bit different. There we have a clear standard, lenalidomide maintenance. At least it was the clear standard until last week, where EMA Europe approved daratumumab lenalidomide maintenance until progression. This is based on the Perseus trial. FDA evaluated that some weeks ago and decided not to approve the maintenance. The Cassiopeia trial, which was presented this spring, has showed that DARA monotherapy maintenance also is better than observation, but lenalidomide is the standard. So at least for now, in Europe, daratumumab and lenalidomide maintenance is the standard of care. Of course, still some process to have this reimbursed in the different countries, but that will be the standard in Europe. Hopefully FDA will sort of approve that later, but they will probably wait for a couple of studies that are randomizing to double maintenance or not, which will hopefully convince them then. But we don't know the data yet, so let's expect that and hope that. So that's where we're at now, DARA-len maintenance. I think this will also change in the future. So the most exciting ongoing studies in this space, there's actually a couple, but the most exciting I think is maybe the bispecifics. They're being used in randomized trials versus len maintenance. There's no results. It will still take a couple of years before we see the results. But we know the efficacy of the bispecifics, so it's really high. So probably it will be superior to len maintenance alone. However, len maintenance, even with some tolerance issues, doesn't have the large infection problems that some of the bispecifics have. So it will be exciting to see how these infection rates are in patients that are with a low tumor load in a good situation early in their disease. It's also a possibility to maybe eradicate myeloma in a fraction of the patients with this treatment. So I think that's a potential the bispecifics have that probably daratumumab len doesn't have. There's also a more conventional way moving forward. It's iberdomide, which is a next generation IMiD, now called a CELMoD, which is more active than both lenalidomide and pomalidomide, which is also being explored in the maintenance setting versus lenalidomide. So it's a more easy drug to sort of handle than bispecifics. It's an oral. Side effects are very, very low. It's easily tolerable. So maybe in the future there will be some intensive way of using maintenance with bispecifics, and maybe some more sort of manageable or easier manageable way with the oral drug and still better than lenalidomide. So I think to sum it up, len is still the standard in US, Europe. Now it's DARA-len. Usually it's the other way around, but that's the situation here now. It will develop into DARA-len in both places and elsewhere also. And then we're waiting for the results of the newer drugs, iberdomide and the bispecifics.